Hi, welcome. My name is Bethany Teachman, and so glad to have you joining us here. I'm a professor and the director of clinical training at the University of Virginia and co-direct the TYDE initiative, which stands for Thriving Youth in a Digital Environment. And it's a new initiative at the university that's designed to look at two questions. Recognizing that youth are developing in a digital context, we're really interested in understanding the impact of digital technologies on youth development, both the good, the bad, and where it's just another developmental context. And then in turn, really leveraging that. So recognizing that youth are using digital technologies, how can we really use that to increase access to care? And we are thrilled to be partnering with Therapists in Tech for this speaker series, and especially thrilled to have Jaclyn joining us today. And we are going to get a great chance to learn from her. And also, I encourage you to ask questions. We'll make sure to save time for the Q&A to make sure that your questions for her get answered. So first, it's my pleasure to introduce Jaclyn Satchel, who is a licensed clinical social worker who brings 13 years of diverse healthcare experience to her work, spanning community hospitals, managed Medicaid plans, mental health group practices, and mental health technology companies. So a really diverse range of areas where she has expertise. And drawing from her extensive background at the intersection of mental health and technology, Jaclyn founded the nonprofit arm of Therapists in Tech in 2022. And it's a very unique online community organization. And as many of you know, it provides essential networking and mentorship opportunities for mental health professionals who are navigating this very rapidly evolving digital healthcare landscape. Through her work, Jaclyn has championed the power of connection and collaboration, believing that meaningful innovation emerges when professionals come together to share knowledge and support one another. And we so appreciate her joining us today to enact that value and share her knowledge and support all of us as we explore these different opportunities. So I'd like to welcome Jaclyn to come join us now.
Hi,
Hi.
everyone. Thanks, Bethany. That was great.
Thanks for being here. We really appreciate it. So, why don't we start off by having you tell the audience a little bit about Therapists in Tech, and then we'll dive into questions.
Yeah, great. Thanks for this. I'm very excited to be here. I love doing things like this. Therapists in Tech started at the end of 2019, early 2020. It was just a community Slack group. There were about 100 of us there. The community founder, her name is Gren Lord. She's a clinical psychologist. Her and I became really fast friends. She actually missed a deadline to apply for a grant with the Melinda Gates Foundation. And I said, girl, we can never do that again. Like we need to be a nonprofit. Like we need to do this so we can like apply for money. And she was also launching her own startup called Empathic AI. And she was working on getting funding for that. So she said, Jaclyn, this is yours. Do your thing. And I said, okay, great. And I just took it and ran. And the rest is history. We have the Slack community is very active. There's over 4,000 individuals there. Global membership. We have people all over the world that are working in all varieties of mental health technology. And that was the goal, and we've achieved it. And now we're growing and trying to figure out what's next.
No,
So,
that's fantastic.
yeah.
I want to go back to the very first thing you said about how it started with a particular relationship. And can you talk about what role that has played in kind of guiding some of the career changes you've made and places you've gone?
Yeah. Every time I've worked somewhere, I've tried really hard to get connected to the people who I see want to make a change in the organization or in the field, and really want to learn from them, getting their advice, want to know their vision. And then I'm a very innovative person, so I like to ideate, and oftentimes my ideas can become reality. And that really played a role in how Therapists in Tech kind of grew. I believed in her idea, she believed in my idea. I had the time, she didn't, and we just we just took it forward. Yeah.
Oh, that's great. So, but stepping back a little, like what initially drew you to the digital health industry, even in the first place?
Yeah, innovation. I was working in a managed Medicaid plan at the time, and I was applying for a role that I did not get. It was a manager position, and my manager at the time was working at a company that's now no longer, we say defunct, called MindStrong. It was a healthcare technology company that was doing text-based interventions for therapy. And my friend went there. She was my manager at the health plan. She went there. She's like, "You've got to come work here too. This is amazing." And so I started in 2020, very early, right before COVID shut everything down, and then
Yeah.
the industry just took off completely like a rocket. And so that was, again, a relationship I had built that got me there. And then I just kept building relationships from there.
No, I think that's interesting. I appreciate you raising COVID because it also highlights kind of that importance of being ready to jump on opportunities, being ready to pivot as circumstances do. And I wonder if you can talk about like where you've seen those inflection points and how what you did to be prepared to be able to respond when they arose, because none of us quite anticipated that COVID would completely change our lives. And well, maybe a couple people saw it coming in that way, but I certainly did not realize that, I'd be having my children home for a year from school and all of the changes.
Traumatized, yeah. Yeah, I am from the Houston, Texas area. My mom and my dad worked in oil and gas, and things changed all the time for us. And so through that experience, it just led me to always see, like, be very optimistic. So when things are changing and shifting and then things look really bad,
Hmm.
there has to be someone or some person or something that can see something that's going to come out of this that could be actually good. And that's just who I am. So even I'm an old woman. So even back in 2008, like the housing crisis, like my parents were able to like take advantage of that and like help me buy a house and take advantage of this tax credit. Like
Right.
there's always something there. And we just have to
Hmm.
do a really deep dive and asking questions, talking to people who have experienced life-changing events. Like what happened
Hmm.
when, I don't know, some other big major event happened, maybe in the 60s or the 70s, and like how did people take those opportunities and like turn them into better things for themselves and for their community? Because not all things that are, yes, bad things happen. COVID was awful. We lost family members. But there was also a silver lining.
Sure. Sure.
Everybody
Usually
understood.
opportunities as well.
Yes, everybody understood that virtual healthcare, which had already been there, right, can be the first line of defense.
Right.
From there, it's like, okay, well then what are all the other innovations that can happen? And that's really how I felt about therapists in tech. Like we have so many good people
Right.
here. And it was only like a few of us, but I'm like, more people need to know about this. More people need to
Yeah.
know about how to look at opportunities and assess them, assess what's happening globally, politically, economically, and how is that affecting your state funding,
Right.
your environment, your healthcare needs, like what's changing in your environment? How can you take advantage of those things?
No, that's great. I want to challenge you a little bit on something you said. You said, I'm just an innovative person. And there's no question that that's true, but it can be intimidating for the people who are watching and kind of wonder, am I an innovative? Like, is this like just something that's natural and innate and can't be developed? And so I wonder if you can talk about, like, clearly you have a natural talent in that space. And I'm guessing you also have cultivated it in some intentional ways. And so to inspire those in the audience who are kind of questioning, like, do I already have this or not? And I will say, I talked to somebody yesterday who was like, thinking of applying for something. They're like, I don't know if I have the good idea. So, like, can you talk a little bit about how you've kind of intentionally cultivated that and what you would recommend for people so that they too can say, I'm an innovative person?
Yeah, I think like if there's an idea, try to validate it. Now
Mm.
we have a great tool to do that. It's called Claude or ChatGPT. You can talk to that person or that chatbot and say, like, is this a good idea? And I would also encourage you, and that's what I do, talk about my ideas to other people, and
Right.
they will validate or invalidate them. Some people don't have the knowledge, but some
Sure.
people, like, you'll be thinking, like, I've always thought, oh, we need this app for childcare. And, there's lots of daycare centers in my suburb, but people don't know where to pick, and they're always asking questions. And so, could an app be like a good thing? And just start talking to people about your ideas. I
Right.
know that's hard for a lot of people. I shouldn't say just, because I also can do small talk. But I think that if you can communicate effectively your idea, you can get back that level of communication on,
Right.
have you thought about this? Sounds like a good idea. There's someone else doing that. Why don't you look at that? And so don't be afraid of talking about things. It could be a similar idea that's already out there, but there's always something that can be done better or differently or have different needs. People have different needs and need different types of apps. Like everybody doesn't like TikTok. People like Instagram or YouTube Shorts. Like think of it like that and
Hmm.
then just start trying things. Start
Yeah.
building the thing, talking to people who can build the thing, talking to the people who built the thing that you like. People are, as a leader, I've learned that if I offer time, people typically will never take it. So
Hmm.
most people who are like
Yeah.
CEOs will talk to the users or talk to people because they have
Right.
the time to do that. And if
Hmm.
they don't, they don't. But most of them will.
Right.
If you have a thought about their product, even if that does inspire you to create your own product that's
Hmm.
similar but serves a different purpose, we have to try the thing. So the person that you were talking about yesterday, they should just apply and be
Right.
not afraid to hear the word no.
Right.
Maybe that wasn't the fully fleshed idea, but we got to keep trying, keep talking to people about our thoughts and see where it goes.
Yeah, that take home message of like take the risk and it's okay to have to fail up regularly is a
That's
big
right.
yeah, yeah.
Yeah.
Can you talk about, stepping even further back in terms of the path you took? Like what, you're trained as a clinical social worker, like what aspects of your training were sort of strengths and helped prepared you for the path that you took, and where did you really have to like fill in gaps, address challenges?
Yeah. So my graduate program, I'm originally from Houston. I went to the University of Houston for graduate school. We have the largest medical center in the world. We have a healthcare focus track,
Mm.
and I really was interested in that because I thought I wanted to be a nurse. And so I
Okay.
really wanted to
Wow.
work in healthcare. I've always wanted to work in healthcare, and I knew that from the outset. So just I was lucky that my city has the right program for me and had the right connections. I knew people that were in the program that worked in hospitals before in different aspects. So I was able to talk to them and really understand like, what are you doing every day? What is it like to work at a hospital?
Yeah.
And the one thing that I feel like I didn't get from my graduate training was we didn't get an ounce of business skill, sales, marketing, finance. Like we didn't learn any of that. And I think that
Mhm.
that was like a real big miss. I
Yeah.
think maybe like healthcare administration master's programs really focus on that. But I think like in a program like mine, we could have had more of that kind of
Hmm.
optional tracks because we even have like you can get an MBA at the same time or a JD at the same time. But why couldn't we have like taken a business class, an intro to finance, an intro to sales to really accompany like our clinical knowledge? Because all of that stuff I had to learn on the job.
Right. And there's
I
a
have,
lot of routes that can use that knowledge. It's not just the
yes.
digital mental health industry.
Your personal finances can be
That's
helped
right.
by that,
Yeah.
right? I mean, yeah.
Yeah. Um, and do you see shifts in training programs that have occurred? So when in terms of like how is your applicant pool for jobs shifted in different ways, and where do you still see like serious gaps in how people are prepared to be successful and thrive in the organizations that you've led?
Yeah, there's still a large gap. There's still a
Yeah.
large gap. And that was one of the reasons why at Therapists in Tech, one of the programs I wanted to get off the ground was the mentoring program. Because I think no matter how much schooling we have in our clinical knowledge, research
Hmm.
knowledge, we just do not have that small business, startup, venture, private equity, all of these things that have infiltrated healthcare. We don't know anything about it. And
Yeah.
so just partnering up individuals so that they can learn this stuff, even if they
Hmm.
don't have that job or haven't had access to apply for a job that would be in a startup environment, that they can partner with a clinician just like them that has similar years of experience, but get that knowledge. One-on-one mentorship
Hmm.
is very, very valuable to like
Hmm.
closing that knowledge gap.
And so for people who are, considering an industry pathway, it wasn't built into their training program, how do you think, what should they do as they're sort of seeking out that mentorship and connection, or just, courses they can take, or what would you suggest?
So since 2020, there have been like a slew of Slack communities that have popped up that, excuse me, really do a good job in providing this kind of information.
Mm.
So Therapists in Tech is one, Health Tech Nerds is another
Yeah.
one. There's one for researchers that are women called Well. Claire Purvis is a leader of that. So there are a lot of Slack groups that you can join that you can find all kind of mentors. LinkedIn is also a good place. And
Yeah.
don't sleep on like cold outreach. People will cold outreach on LinkedIn to me, in a Slack DM, in a group, a Slack group. And then I meet with them and then I help them in whatever way I can, or I get them connected to the people that they need to get
Mm.
connected to. So just trying to get into these places where the people are. I mean, maybe there are even some LinkedIn groups or even some Facebook groups may be helpful, but I
Right.
would want to be where everybody's kind of hanging out, reading
Yeah.
the same things, following the same people. That's what I
No,
would recommend.
no, that makes a lot of sense. Um, so I want to shift a little bit to give people kind of a glimpse of a day in the life. So like I mean, let's start with like what are the responsibility of your current roles? And then, what is that so conceptually, and then what does that mean sort of like hour to hour, what a day looks like for you or a week looks
Yeah.
like for you,
Yeah, so currently I'm running my group practice. I've taken all the skills that I've learned over the past 5 years.
right?
I've been building my group practice in the background. And so day to day, currently, I'm mostly a therapist, but then I'm also supervising clinicians who want to become licensed clinical social workers and also helping them establish their businesses and what they think that they want to do when they become independently licensed. I'm also doing consulting for some previous companies that I've worked at, doing all kinds of things, operational questions,
Yeah.
fee for service setups, um, onboarding training, looking over those kinds of materials, really helping people understand how to operationalize, like
Hmm.
from A to B or early A to Z.
Hmm.
Maybe a pipeline of therapists, how to train therapists, how to prepare them to work in a virtual environment. I've done so many things.
You have.
Yeah, it's
Uh, so let me take you back a little bit to the consulting that you mentioned, because I think that's one of those words that can mean like 100 different things.
it can.
So can you, help people like bring it to life a little bit about like which things you say yes to, which things you say no to, how you became a person that was asked to be in those roles.
Yeah, I think to start, a person that was asked, I asked if I could help. And sometimes, like, I think that's taken for granted that if you
Yeah.
see someone with a budding business or an emerging business and they have like two people and they're really excited on LinkedIn and they post about it and it's in your wheelhouse, reach out and say, hey, I'd love to help with this. My
Hmm.
clinical specialty is perinatal mental health. And I've worked at, I actually launched the perinatal mental health program at Pomelo, which is a Series B startup. They've raised a lot of money. They're doing great work. So just with that alone, just me saying like, I was there for 10 months, helped set up their entire evidence-based program, helped set up their fee-for-service model for Medicaid. I can say that. And then people say,
Hmm.
oh, I need that type of help. So then
Hmm.
I'm consulting with other startups who want to bill for a service. Well, they don't know how to set that up. They've
Right.
never started a practice or launched a PC or anything like that. So they may want to know, like, well, how much would I actually get paid? What would
Hmm.
the average pay rate be for this particular service? And if I don't have that knowledge, I have a wealth of people that I can pick up the phone and I can ask them. And then there's
Hmm.
also like research companies that reach out because they're trying to validate their own ideas.
Mm.
And typically, what it is like a venture or a private equity firm pays a research firm to go out and find consultants to say, have you ever worked on a product like this? What was the feedback? What was the retention rate? What were the users like?
Right.
So that it can inform them on where they want to spend their money.
Hmm.
Then you get those kinds of opportunities too. They look like spam and they're definitely not. But it's like a like the way they write those emails, it's like they need to change that.
Yeah,
But
yeah.
that's kind of how you kind of get into it is that you just start talking to people and asking them, can you help out? And some of that stuff you
Mhm.
might have to do for free or for equity. But eventually it becomes paid work because you're able to speak to, I've been working and doing these things. So now this is
Right.
my pay rate for this.
Right. So you sort of build up once you've established some credibility in that space and experience.
Right.
And you're the fourth company I've done this for. And yeah,
That's right. Yep.
that makes a lot of sense. Um, so as you said, you've done a lot of different things. Can you talk about like what has guided the decision to shift to a
Mhm.
different company or role or things like that? Because you and I were talking earlier, that's less common in academic spaces, but super common on the industry side. And so, like, what guides your decision making there?
Yeah, typically it's money. I'll be very
Mhm.
honest. Sometimes companies don't have a lot of money to pay you. And then you get, contacted by other companies and they're asking for you to come work for them. The pay is better. There's no hard feelings. People understand that we're all adults and we have bills to pay. And so sometimes that's the case. Sometimes it's ethics. Sometimes the ethics change with the company as they continue to raise money. Sometimes it doesn't. Not all companies are bad.
Of
Some
course.
become bad, right?
Sure.
So, like, the goal of the company has to shift because the amount of money that they have invested has shifted, the board members have changed.
Hmm.
So, the nature of the business has changed. Sometimes they've run out of money and I've been laid off. That's happened too. And
Yeah.
so, it's just a forced shift almost, also. That kind of has to happen. So, those are kind of the ways that and also just the climate, politically, is the funding going to sustain?
Yeah.
Lots of people are getting laid off right now because we talked
100%.
about this earlier. A new revelation to the startup landscape has been finding other ways to fund their projects outside of venture and private equity money. And a lot of people were applying for small business innovative research grants, and that was fully funded by the government. And we're talking of upwards to $3 million that people were getting. Well, a lot of that funding has been slashed. So some people are getting laid off now, and it's causing them to kind of pivot a little bit also. So I think that that's kind of my answer is that it's financially driven, but also ethically driven at the same time.
No, I appreciate that. And I appreciate you sort of acknowledging the layoff part because it's pretty common right now that people are facing
Hmm.
those challenges. Um, And so, yeah, I think it's really important that we talk about it and not only present our successful moments and sort of talk
Oh
about like the
yeah.
whole journey. I want to take you back a little bit to the comments on ethics because I think that's on lots of people's minds as they're making these choices. And can you talk a bit about, and I think this is relevant for lots of different spaces we operate in, not only the digital mental health industry, but how you've thought about like how you work within to try to shape something to be more aligned with your values and ethics versus at what point you're like, I'm out, I don't think it's going to get there. And kind of how you've navigated that and what you would guide people on. Because I'm seeing having that conversation with people again who are working in a lot of spaces right now where whether it be administration related changes or, other guidelines that are making it hard for them to work in the way that they want to and used to and all those things.
Yeah, actually my very first entrance into this industry at Mindstrong was a very clear eye opener. And I can talk about them now because they've been out of business for a
Right.
while. So I won't be in trouble because that happens too. And
I'll
startups get
pretend we're
lots
not
of,
recording and this won't be shared.
yeah, and
Just between
also
the two
like
of us, you're good.
right, but there's lots of NDAs that get signed. I've been laid off twice in this industry. There are tons of things that you cannot say,
Yeah.
non-disparagers. There's lots of stuff that happens here. But I remember quite vividly when I was at Mindstrong when we were shifting to this model that I was just completely uncomfortable with. There was
Mhm.
this overnight procedure that they wanted to have, and we'd have to all be on call all over the country. And we all, like, not we all, but several of us who were older clinicians were like, well, if a person is having an emergency, a clinical crisis in Washington, and I'm not licensed there, how can
Mhm.
I accurately support this person and ethically support that person?
Yeah.
And so that actually signs you up for more work because they're like, okay, Jaclyn, well then we rebuild this
Yeah, yeah,
thing,
yeah.
right? So
Be
then
careful what you ask for. Yeah.
that's right. And so then that's what happened. All of a sudden, I became a part of this committee where we actually changed how we rolled out on call, how we communicated, what words would our AI, and this is even back in 2020, we had machine learning would,
Yeah.
because the person would message in, what would the message be to this person that's in crisis? And
Hmm.
then it became to a point where we saw, well, I saw how the company was shifting to this biomarker technology and it wasn't really working and the clients were upset. And I just said, I don't know if I can keep doing this. And all of my ideas, the leadership, I was able to talk to the CEO before I left and
Hmm.
just tell her how I felt. But ultimately, that's what I learned is that sometimes the business goals and the business objectives are contraindicated for how I feel and how I'm going to operate every day. And again, it's no love lost. We're not upset at each other, but I'm just going to
Hmm.
go a separate way and do something different because I
Hmm.
can't. And also, honestly, I see the writing on the wall because my brain just works. And so people are like, wow, you got out at the right time. And I'm like, well, I could kind of see the unraveling. Like y'all didn't see how the all hands were changing, the language was changing in the room. Like, and I would, again, I have a mother who worked in corporate for a long time. And so I would talk to her like, when they say these words, what does that actually mean? And she's like, oh no, like, doesn't sound good. Like, so
Yeah.
there's that business speak again. There's things that I had never heard before that I would not have heard had I not worked in this type of corporate setting. Before
Right.
that, I'd worked in hospitals and hospital administration, and that was much different than working in a actual small business with lots of money. That's a different
Hmm.
environment, lots of technology, lots of things on the line. It's different.
Yeah, no, for sure. Um, it sounds like you had a wonderful mom who kind of, has, shared some of that knowledge with you, and you had particular background experiences that allowed you to sort of see what in academia we call the hidden curriculum, right? And you're sort of describing a similar process that occurs. And so I wonder, if you can talk a little bit about how to level that playing field, how to help people like discover that hidden curriculum in different ways and feel a little bit less lost if they didn't have those earlier opportunities or the mom
Yeah.
yeah, that had that experience and could share that knowledge.
Yeah, I would definitely be looking for the finance person. Like
Ah!
typically
It does
in
come back to money, right? In
listen,
academia too, though, let's be honest.
absolutely right. Like, can they actually fund that position? Like,
Right.
what's the runway here? Like, how much money y'all have left?
Yeah.
How often, how often are you all assessing the validity of these positions? Like, is it really making the business money?
Hmm.
And actually, in startups, it's very different. If you get hired on, you typically can talk to practically anybody in the company, unless it's a big company. Like a Spring Health is still a tech. We should really stop using the startup term because they are old now, but they are still
Yeah.
in this environment where they haven't gone public. So, like, of course, like in that environment, you may or may not be able to reach up like
Right.
that. But for some of the medium to smaller size companies, you can actually call a meeting with practically anybody. You can send them a
Yeah.
Slack message and say, hey, I'm having some thoughts or feelings, and I just want to know if you can validate. And that person in their role will or will not share whatever they feel like they can share. They're not going to share the CEO's paycheck. They'll just share what's valid, like to
Right.
validify your concerns about your position if that's what your questions are. Like you're
Hmm.
able to have these conversations pretty openly with these and if it's not open, then that's when you know that there's something
Right. Why is it not open? Yeah.
right.
Yeah, I feel like there's a kind of underlying theme to our discussion so far that's really about curiosity. Like
Yeah,
curiosity, take risks, ask the
that's right.
questions. Don't be afraid of the answers, and then you decide what you do with the answers, but like just keep asking the questions. Um,
Yep.
so, I guess building off of that, where do you see people who are starting in this field? Like, what are the misconceptions they most commonly have? What do you wish they understood better that would maybe allow them to make choices that are a better fit for them in the first place, kind of thing?
Yeah, one thing that's changed over the past 5 years are the salaries. They're not as high as they once were,
Yeah.
especially starting out. And because, like we kind of talked about earlier, money isn't as cheap. So the interest rates have a lot to do with how much money people can borrow or how they borrow money to fund their business. And so with that, they have to make the money stretch longer, so the salaries aren't as high. And so
Mhm.
that's a misconception is that people think that they're going to get a really high paying
Right.
job, very flexible, which it is, but there's a lot of work to be done. There's always something to do in a small business, and there's always new assignments that you can either volunteer for or you'll be voluntold to do. And there's also a misconception that you won't work late hours. I mean, the things that people used to see on social media, some of that was true. Like, I play tennis in the middle of the day, but I also have to take that hour and a half back in the evening.
Sure.
And that might be after my kids are in bed.
Right.
So that's what it looks like. That's what the flexibility actually is. And I think there's been a lot of course correction with the salaries. So
Mhm.
people aren't getting I saw some crazy stuff.
Ah!
I saw so, and I'm not like, and I'm glad people were able to get it when they could, but a lot of people don't have those positions anymore.
Yeah.
So it's just
So,
kind
you've been in the field for some time, although I am concerned you keep referencing yourself as old because I'm pretty sure I'm older than you. So you got to watch that. But nonetheless, yeah, I'm curious if you can talk about like what advice you would give to people coming out of graduate school now and how that differs from the advice you would have given 5 years ago and 10 years ago and what that looks like.
network, like go to all the networking things, follow the people on social media that you admire and you think that are doing good work.
Yeah.
See if you can get a meeting with them. Again, just try. You never know what's going to happen. They could say yes, they could say no, they could say we'll talk asynchronously.
Yeah.
And then also don't be afraid of relationships to change. Things just happen. People get more busy, they get less busy. Um, Again, it's just like you got to take more risks. And I didn't say this to my mentees back when I first started. I had mentees. I always loved to mentor people. But I just think building, it's different now because a lot of networking is done online. But just don't
Yeah.
be afraid to try to just outreach to people that you think are important. See what they say back. They might write you back. You might not get a meeting, but I think that that's important. And then also really find a mentor, and you are going to have to be aggressively getting on their schedule. They may not be able to do that. So set up a scheduling appointment link for yourself, or just make it easy for people to book time and chat with you, but be open, be flexible, be
Mhm.
willing to take a phone call instead of a video chat, or maybe
Sure.
just do text message instead of having a video call. But that would be what I would recommend.
So let me ask the sort of now what question, right? So like you get your 15-minute meeting on the calendar. What do you do with that 15 minutes to make the most of that time?
I would, especially if there's a typical, like a position that you are interested in. Like, let's say this
Right.
person is a product manager, you want to be a product manager. I've been a product manager before. That's a term that's very loosely used. So you want to know, like, what do you do every day? Like, what's the
Yeah.
worst, the hardest part of your job? What's the easiest part? Like, what do you love and what do you hate? Like, that's what you need to know. Like, what do people hate about their job? Um, and then if they're willing to share, ask them how much they're getting paid. Like, we need to be knowing this stuff. Like, we have a pay equity channel in Therapists in Tech I started. It's anonymous and people can post. We did a really good job about a year and a half ago posting a lot. We don't post in that channel that much anymore. But those are the questions that you need to ask. And you can even ask them, like, what is the range? You don't have to tell me exact number, but what's the highest, lowest? Like, tell me a range so that I'm not like going into this blind.
Yeah. Yeah.
Because I may be looking at another industry that could be more like that might be what I'm after, like
Mhm.
more money over here or not, whatever. But you want to know like all of these, like what's the worst, what's the best, and what's the pay range here? Like, what
Yeah.
should I be expecting?
No, that makes sense. And I'm curious if you can comment on, when you're talking to foundations, and you're getting advice on that, the advice tends to be like, before you make an ask, like build a relationship and stuff like that. In this case, whereas in other conversations, it's like just be really direct and explicit about what you want. Don't waste the time,
Yeah.
so to speak. And these kinds of 15-minute opportunities for people who are looking for jobs, for people who, things like that. What do you recommend in terms of that continuum of relationship building, direct asks, all of those kinds of tricky things to navigate?
Yeah, I think the relationship building comes with the ask initially. Tell them who you are, what your experience is, what you want, and be nice about asking. Like, my name is Jaclyn. I'm a clinical social worker. I really want to be in clinical operations. I see that you're a VP of operations. I really want to know how you got there. We can share. We may share. Sorry, my camera's there. We may share something. My camera again. We may share something in common that we could discuss. We have children. If I hear you say you have kids, and I can say I have two sons also, like something like that.
Right.
Um,
It's a
those
human on the other side, right?
that's it. That's it. And
Yeah.
just that's your relationship building. And just be clear about your ask. Like, I just need 15 minutes, or I just want 15 minutes. And that person could take a liking to you and say, "Hey, do you want to meet again?" And you could say, "Yeah," or you could say, "No, I'll reach out. I don't want to take too much of your time." Things like that. But that's what I would recommend.
No, that's really helpful because I think sometimes the not asking for the meeting comes from a feeling intimidated about what that would actually look like. So I think
Yeah.
that sort of concrete, like, here's how to approach it is really, really useful.
Yeah.
Um, okay, I'm feeling this internal pull of like, do I keep being selfish and ask all my questions or acknowledge that there's already 9 questions in the Q&A? So I'm going to be
Mm.
do my due diligence and we'll go back and forth a little bit. So first of
Mhm.
all, thank you to everybody for adding all these great questions. Keep them coming. So the first one is about can you share the Slack communities that you've been mentioning? Therapist and Tech Link, Claire has already put in there. Health Tech Nerds, are there other ones you'd want to like pass along to folks?
Society for Digital Mental Health, they're more research focused, but I don't know if they have a Slack group, but I
I'm
will.
on the board. We don't have a Slack group,
Okay.
but become a member and then you'll get lots of access to opportunities. It's free to join. So
Yes.
thank you for the plug. I'll put that one in the,
Great
chat.
organization also. Great organization also. And then there's one more, but it's not a Slack community that's free. There's Out of Pocket. He is a tech guy who became obsessed with mental health technology, and he has an amazing newsletter.
Hmm,
His name is Nikhil, I think, and it's hilarious. But he does deep dives into all things like mental health technology. And in order to be in his Slack community, you have to kind of work on projects, kind of too.
hmm.
Like, you have to kind of give a little to get a little there. So I would definitely look into his also. And I'll have to.
But those are great networking. Like working on the
Mhm.
project is a win-win, right?
They
Like,
are. Yep.
yeah, yeah.
Yeah. Yeah.
That's great. All right. So you were asked, could you talk a little bit about how you learned how to set up things like fee for service and interfacing with Medicaid? And was that just trial and error once you were out of graduate school? Or is there a primer training that graduate students could take to learn more about this aspect of service
There's
provision?
no training on that.
Ah,
So I started my
wrong
own
answer. No.
practice. I know, right? I started my own practice in 2020, in November of 2020. And I had a mentor who had been in private practice already for like 10 years. And we are really good friends and we talk all the time about all kind of other stuff. But I would just ask her questions and she'll just tell me like, "Oh, you need to become a Medicaid provider." And then I'm like, "Well, how do you do that?" And then she'll say, "Well, you're," because she's in a whole nother state. So
Yeah,
she's
yeah, yeah, yeah.
like, go to Texas Medicaid, and then I would just spend time reading. I would get into, so most clinicians, therapists they live on Facebook. So I would get into all these Facebook groups and I would just read, 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 read. And I would Google articles and I just did a trial. It was a trial and error in my own business. Like,
That's
I
funny.
had
Yeah.
already, and I use the EHR, which is also technology. I tell private practice clinicians all the time, like, you're a clinician in technology, you use the technology. And before I used my EHR's billing, I wanted to bill myself because I wanted to teach myself because I never wanted to hire a biller and would not be able to understand what they're doing.
Yeah, no
So
fair.
I just did it myself. I just taught myself. Google is a great tool, and now we didn't have ChatGPT back then. I am 100% sure you could probably ask ChatGPT to have like outline steps on how do you set up a fee for service for a Medicaid state A or whatever.
And that'll get you probably 90% accurate information
There
that
we
you
go.
by someone, right?
You
Like it's
still
like,
need a
yeah,
human. You 100% need a human.
yeah.
But yeah, that's how I learned. I just read, 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 and just tried. And also, like, I'm trying these things and I'm doing billing. And if it gets rejected, you call the insurance company, which is also it's a slight nightmare, but then they just tell you what to do.
Yeah. Yeah.
They'll
Yeah.
just
No,
tell
that makes
you.
sense. Yeah.
Yeah,
There is a self-correcting process in there, right? So
there is.
no, that's great. So first of all, as a demonstration of how dynamic this field is, I'm getting chats coming in correcting things I'm saying. So I have to share that the Society for Digital Mental Health Student SIG does have a Slack. So
Oh,
people are,
nice.
yeah, so not the like general membership, but there is one. Student SIG is ahead, as you might guess. And
Love that.
so join the Student SIG, and then you can join that Slack, which is great.
Nice, nice.
Um, so someone is interested in understanding what is your approximate clinical mentoring consulting percentage split of your time, and how much have you been able to, like, how much is that sort of something you intentionally were like, this is what I want versus, hey, this is where the money is, and how is that varied?
Um, I would say right now it might be like 35% of my time currently. But this is because I used to work for some of these people and they like start another business and they're like, well, I need help with this. And I'm like, okay. And then I just decide how much time I have because that's typically what they ask. And you need to be very firm and clear on that. They'll say, well, how much time do you have to dedicate to this a week? And I'll say, I have 3 hours. And they're like, okay. And then it's way more hours than that.
Of
But
course.
you have to be able to say, I can only do these things for this amount of time because I have these commitments. And I
Right.
had a hard time doing that earlier on. Now I don't.
That's funny. So what helped you? I mean, I think for many of us, the saying
Yeah.
no, setting boundaries is not a natural skill, because part of what got us into like leadership positions is that we were like, yeah, I'll grab that opportunity. I'll go for it. Like, right, So how are you now? You said you got better at it. So now we're back to a personal question for me.
Yeah, yeah,
How
yeah.
did you get better at it, and what criteria are you using to make those judgments?
I really try to, like, my friend and I, we talk every day, and she'll say, what's on your schedule today? And
Little supportive accountability. I like it.
that's right. She'll say, that's way too much, ma'am. And I'm okay, I'll do better next week. My husband also holds me accountable. He's like, let's talk about your schedule.
Oh, that's funny.
School is coming up. Don't you want to switch to something different? So, but I also invite that. Like I tell friends, family, everybody, hey, I know I can become a workaholic. Like it
Right.
just happens. So feel free to tell me what you see, and I will 100% make some sort of change. It might not be the whole change, but I will
Right.
make some change, and I'm committed to that. And so I'm having
Mhm.
them hold me accountable, and then I hold myself accountable.
I'm good at the first half. My husband tells me I need to make a change, and then whether I follow through is a whole other thing. But I hear you. So we have a question. If you can talk about the ways that you involve patients and community members in co-design and delivery for digital therapy work.
Yes. Okay. So actually, and I haven't done this, but this is a good idea. So I had a company reach out. They wanted to test out like an AI agent on my website.
Hmm.
That way people can quickly book appointments. And
Yeah,
so, of course, because I love technology, I said, yes, I do this. And so it's sitting on my Safe Space website. And I just ask people to test it because she wants people to test it. So I just ask
right,
my clients, hey, can you test this thing, see if it works, and give me feedback? And they will do it because they love that.
right.
Clients love to be involved in this. I redesigned my website like 2 years ago. There was actually, I met a young lady who wanted to be a UX designer. She was in therapist and tech, and I had not revamped my website for my private practice, and had been 3 years. And she wanted to use it as a test. Go ahead, thanks. And then she wanted some clients to kind of play around with it and give feedback. So I engaged some of my clients, and I said, "Hey, I would really appreciate your feedback." And the one thing that I think I should do or we should do is we need to pay these people for doing these things. And I don't do that. And I'm catching myself in this conversation thinking about that. But that's how I would engage clients to test out things. Yeah.
No, I like that. And I think it ties back to some of the earlier points of like, in addition to that, like take risks, be curious, but it's also like I hear you saying repeatedly, don't be overprotective at early stages. Like it's okay to put something out there that is like needs development, and
Right.
to like sort of recognize like that's not a problem. That's like the
Right.
process.
That's it. That's
Yeah.
right. Needs
Yeah.
to be broken, the things.
Yeah. No, that's great. Can you talk about how you've seen attitude shift to, we obviously talked about COVID as an inflection point in this way, but how you've seen attitude shift to kind of like comfort with digital therapeutic approaches and when people are not comfortable, how you've helped them to get there. And I think, I'll say like this wasn't exactly in the question in the Q&A here, but we know that certain communities tend to have more higher digital literacy, greater comfort levels, those kinds of things. For example, for underserved communities that many of us like that's driven why we were interested in digital interventions to
Mhm.
increase that access. How are you helping people to like get more comfortable with these approaches?
Yeah, well, we were at Pomelo. We started out before they were building their proprietary EHR. We were using Spruce Health, and I thought that was an amazing tool. And we gathered and we talked about what would actually work for a Medicaid population. And we discovered through all of our conversations is that text messaging works best. And so I think assessing who you're serving,
Yeah.
and there's tons of research on patient engagement. We do a lot of that at Postpartum Support International through research development. Even like PCORI has tons of information on how patients engage. And I think like that, again, here we are again, like that's the clinical research that ties into digital mental health. How do people want to be? How do people engage with their current technology and how do we meet them where they are? I have
Hmm.
clients currently who are talking with ChatGPT in between our sessions and then coming back and talking to me about their conversation. So that's them telling me, and then I can engage conversation with them like, how did that make you feel? Do you talk to your friends? Do you feel embarrassed? Is there shame around it? But that's kind of how I assess that is there's lots of research already done. And then simply asking the population, so a quick survey tied to a gift card, it's really
Yeah.
helpful to get people's feedback and understanding.
Yeah, just keep asking. No, that's great. So there's a question here asking about, how long you worked on the clinical side before deciding that you would, in essence, add in some of the industry side. It's not like you've abandoned the clinical side, but you've sort of, it sounds like had different times where that balance shifted a little bit. So what made you decide to like add in that digital piece more intentionally?
I think so I had starting out in healthcare, I worked in community hospital settings doing discharge planning, and we were a large hospital system that was bringing on Epic as an EHR,
Yeah.
and my director was like, "You're going to be our Epic champion." And
Cool.
this was like, I don't know, 2000 13 or 12, I can't remember. And that was it. I was like, this is amazing. Like we could be designing and developing things and get patients' input. Um, so even from there, I sought out opportunities to bring them both together. Even when I worked at
Mm,
Texas Children's Health Plan, which is a HMO Medicaid
yeah,
here,
yeah.
we really wanted to make sure, like, again, how our assessments were flowing with the
Mhm.
clients in mind. We're going out to their homes. Like, should we bring this big computer? Like,
Yeah.
should we get a tablet? Should we be writing? Like, I've always, this is always kind of, technology has always been there. And I think again, we don't see it like that. We
Right.
think we're not working at a big name that is technology that we're not. Like we are using
Mhm.
technology every day with clients. And so I feel now being have been a therapist for 6 years and doing this digital work. I've been a social worker for 13, but
Yeah.
actually being a therapist for 6 years and doing
Mm,
this work, it feels good because you have your population. You're just chatting with them and you're
yeah.
they're telling you exactly how they feel most of the time, right? And so just taking that information and then using it and applying it to all of the operational things, because that's what they're asking. They're asking for, I don't know, like, how do we get to them quicker? How do we get them to answer the
Right.
phone? Or how do we get them to respond? Well, in your therapy session, you could talk about that, or they will talk about that. Like, I get too many text messages from this, whatever. And they're like, oh, okay, well, we should not send a lot of text messages, maybe, because the clients don't like
Right.
text messages from Ralph Lauren or wherever. I don't know. Like they don't
Yeah.
like it. So like just taking that.
No, I really like that because I think, and please correct me if I'm misunderstanding, takeaways from what you're saying, but to me, there's two key points that you're highlighting there. One is that you're flipping the question. I think too often people ask, what uses can I find for this technology? And instead, you're flipping it and saying, like, what problem needs to be solved? What need has to be addressed? Like, let's
That's right.
really, pay attention. And then that guides the technology changes
That's
rather
right.
than the other way around. And I think there's
Right.
way more potential for success when you're like, the problem exists, the gap is there, versus let's create a need for something.
That's
Uh,
right.
yeah.
Yeah.
And then I think, I guess the other thing, and I'm curious how you think about this, and as someone who does have that like active clinical role as well as your sort of business consultant, all those other roles, you're kind of have this already built in. But I guess one of the things I take away from your comments is like, kind of how do you stay proximal to the people who are going to be like benefiting from hopefully the tools and all those kinds of things, and how would you advise people who are not also doing like a part-time practice to like make sure that they don't lose touch? I think about this, I teach intervention class and I always make sure I still see a couple clients myself, even though I'm mainly a researcher and an educator and all those other roles, because I'm like, otherwise it's going to feel really
It does. It does.
yeah, like you can tell the person who's like not actually talked to a human about these issues for a really
For
long
20
time.
years. When is the last time you talked to someone?
Right. And so, for people who don't have, like, you have it built in, and probably that was partly intentional in what you wanted as a structure. But for people who are, for example, in a full-time role in industry, like, how would you suggest they make sure that it does kind of stay real, stay connected, stay proximal?
Yeah. I think, and this is kind of difficult. I don't know how to say this, but even I'm doing on a study for a technology company that did get an SBIR grant. I'm
Yeah.
conducting the interviews of all the Black pregnant women. So,
Yeah.
like, there's another connection. Like, they needed a person to do these interviews. It's not therapy.
Yeah.
And so,
But
but you
it
need
builds
to.
those skills, you have the connection, all of those things.
That's right. So opportunities like that, maybe there are some other touch points that you can make.
Hmm.
Doing surveys for people face to face or over the phone. That way you can actually ask some questions that need to be answered and like you can really get a sense based on their tone of voice, the inflection, like you can really understand like their emotion tied to whatever this product is or what you want or what you're trying to build or whatever their gap is that you're trying to close. So trying to look for opportunities to get in front of the user, like that's always the goal, is to get in front
Hmm.
of the user. And I think that every company that I've worked in, that's what the CEO hates the most, is that they get further and further
Yeah,
away
totally.
from the people that are actually using this product because they wanna see that. They know that that
Yeah.
connection is important. We get to experience like the lights turning on, that they uh, got what they needed. They feel good at the end of the conversation, or they got that resource that they had been looking for, or we were able to talk to their doctors and connect them in a way that then now they have the medication that they wanted or needed.
Hmm.
And so that those are the things or the ways that I think that people can remain connected, aside from like going to work part-time at somebody's practice.
Right, right, sure.
Yeah.
Yeah. No, that's really helpful. So I want to pivot a little bit in our questions. So you have lots of areas of expertise as we've talked about. So like clinical team leadership, program development, healthcare operations, quality assurance, performance management, digital health innovation, right? Like there's a lot of things. How much did you build that skill set intentionally? How much of it was serendipitous? You're in a role and now I got to figure it out, fake it till you make it. Like what did that look like?
It was that last part. It's serendipity. Like it just happened. Like you work at these businesses and then they need something else. And then you say, I'm actually interested in that. I think I'll do that. It was just me raising my hand all of the time because I always want to learn something new, always. And I knew that no matter what, like it's not going to be forever, like this
Yeah,
opportunity. So even if I only got to do it for 4 months, like at least I got to do it and I was like,
totally.
all the way in and, built this thing or had this idea and was able to like at least give it to someone else to execute. But yeah, it was mostly just me raising my hand or just right place, right time where they had other opportunities.
Mhm.
But that's really how it worked out.
And how much, as you've pursued those opportunities, you've talked a lot about like the networking and sort of asking for advice from people who've been in those roles. How much have you also done the like continuing education, lifetime learning? Like when did you add a class or like a workshop or things like that to like get more maybe formal training and versus that more informal mentoring and things?
I mean, I don't know if I've had any formal training in this space. I have wanted to and thought about getting an MBA just because I thought
Yeah, I bet.
that
Sure.
might be the closest thing to really solidifying like these experiences that I've had over the past 5 years. And I always tell people that like I feel like I got a mini MBA all of a sudden because I've just been working like directly in these business places, like just doing all things business, like tying things to OKRs and business goals and outcomes and really seeing, your hard work, turn into something magical. So yeah, I haven't taken anything formal, but I have always been thinking about going back to school to get a business degree.
Yeah, it's hard to carve out that space. I mean,
Yeah,
I think part of my question comes from, I'm in clinical psychology, you're clinical social work, but like both of us probably have that like don't operate outside your competency as a like
that's
part
right.
of ethics, right? And so um, can you help people with how you think about that on the digital mental health industry side versus how you think about that clinically and making those choices?
Absolutely. And you will see it happen that people have these
Oh yeah.
positions and you're
Well, I'm
like,
asking because you're like, ooh,
yeah, I don't know
I
if you
don't know if
should
that was a
do
good idea.
that. Right. And so you got to think about your own, you have to be honest with yourself, your skill set. Like, can I really do this? A lot of these things that I've had the opportunity to do was just wrapped up in the position that I had, and because the company was just so early.
Yeah.
But like, I would never ask to be the VP of operations. No. Like, manager, sure. Director, maybe. But like, no. And that's a conversation a lot of me and my friends have often. Is that like, at what point do we actually say that we've had enough experience to take it to the next level or to actually apply for like certain kinds of jobs?
Right.
Like you really have to have, I mean, I have a meeting every other Friday with like three other individuals that we all are very passionate about this. So we're always talking about industry things and
Hmm.
job roles and tasks and, we just like bouncing ideas off of each other. Because yeah, like you want you want to make sure you can do the job
Right. You want to do it
in some
well.
fashion. Like you're not going to be able to meet all the expectations, but you want to have the competency of most of what you're applying for.
So maybe that kind of like 80% rule, like,
Yeah, you
uh,
need to have at least
yeah,
80. Yeah,
yeah. And I think it's also that piece of like knowing when you need to bring in help.
that's
Um,
right.
I always say when I'm hiring, like, the people I need are the people who know what they know and know what they don't know,
That's
right?
right.
Yeah, yeah.
That's a big deal. Yep.
So we only have about a minute left. This time has flown by.
Yeah.
Before we wrap up, is there anything that I haven't asked you that you want to share for early career folks who are watching about, advice you'd share for them?
Yeah, I just want to repeat what I said earlier. And I've always told anybody this, like, please like cold outreach people on LinkedIn. Like, you never know what you're gonna get. I've had conversations. I was on a rant the other day. I don't do this often, but about EHRs. And then I met with Simple Practice CEO. Like, we had a great conversation. Like, he's like, "Hey, I saw your, like, I want to talk to you about that." Like, you just don't know. Like,
Yeah,
I think what early career professionals should understand is that in the industry side, this is a business and these people want their businesses to do well.
yeah,
So their incentive is to better understand how their product can improve at any point in time.
yeah,
A good CEO always wants feedback,
yeah.
and that should trickle down into their company. And I think that I was able to reach him like that because I didn't get to meet him at the Going Digital Behavioral Health Tech Conference, But I met a lot of his colleagues and we had a long conversations. I introduced them to other clinicians that are now doing other consultant work for them. Like, so I just want you all to take the chance, just take the risk and don't stop until you get what you desire, what you want, or even just the knowledge so that you can make a good decision for yourself.
Yeah, no, absolutely. Um, well, thank you, thank you, thank you. This
I
has been
love
such
this.
a rich conversation and really appreciate all of the advice that you have shared. I think you're going to get a lot of follow-up of people asking, reaching out
Fine with
to
it. Yeah.
you. So, Jaclyn's LinkedIn, I think, is in the chat there for people to find, which we really appreciate.
Yeah.
And yeah, thank you again for taking
Yeah,
the
thanks
time,
for
and
having
thanks
me.
everybody for joining and the great questions that were raised.
All right. Thank you.